Welcome to the model 552 Noelle childbirthing torso. It's driven by this little box, and you can set the delivery speeds from, say, as quick as 2 minutes to as long as 20 minutes. And you can set the fetal heart rate from as low as 60 beats a minute to as high as 200 beats a minute. So what this means is that you can pre-program, if you will, the birth as you want to illustrate some particular point in obstetrics. Let's say that you set the heart rate at a nice healthy 140 and a delivery the fastest possible speed, which we have a speed of 1, which takes about 1 minute. You have a pause resume feature. Pause, the delivery stops. You can indicate something that you want to talk about and then resume again. And standard on-off switch. The power for the Noelle assembly is an international power supply that can be used anywhere in the world. Now, let's look underneath Noelle. See what we have here. It's easily unsnapped, revealing the fetus in the ROA position. This wire attaches here so that the fetal heartbeats will be heard through a speaker that's positioned right here. And you have a placenta that can be located low or high, and the umbilical cord can be in a standard position or it can be wrapped around the fetus's neck. The cervix is here. It's removable, snaps out, snaps in. It starts out at about 2 centimeters in diameter and automatically dilates as the fetus goes through. And the vulva also is easily removable. And spare vulva are supplied and spare umbilical cords are supplied. Now what we'll do is we'll try a birth using the Noelle. All right, now we're going to do a delivery with Noelle. We'll start Noelle, and when we start the procedure, we'll be able to place the stethoscope on, and we'll be able to hear the fetal heartbeat, and we'll be able to see the fetus starting to move down the birth canal. Noelle starts, stops, we'll start again, and then stop, and then start the delivery. The entire delivery will take about a minute. And we'll be able to observe the fetus moving down the birth canal, and if you look very carefully, you can see the cervix dilating and as it's coming toward you. And again, you can be able to check the fetal heart. You can pause at any time to illustrate a particular point. You can talk about the fontanelles, for example. All right? Check the fetal heart again. If you want, as an instructor, you can reduce the fetal heart rate to illustrate some sort of emergency situation, or bring it back up to a normal condition and then resume the process. We're starting to get to the point of crowning now. I'm going to facilitate the delivery just slightly. I'm going to pause at this point and say, okay, now let's talk about, is the nose down or is the nose up? And that can be determined by the fontanelles. And have the students get ready to begin suctioning at the point. Notice now the baby is starting to move over in this fashion so that the shoulders will begin to present. Stop at this point and suction if you wish. Restart. We've designed a slight bit of shoulder dystocia in here so that the shoulder can be manipulated around slightly. Now there's an optical counter in the mechanism so that when the shoulders are delivered, the motor will stop. And at that point, the delivery is complete and the student merely removes the fetus in the normal way from mom. Now we've delivered the fetus, and we'll care for it, and we'll be able to, of course, clamp and cut the cord if we wish. Now that the baby has been delivered, as well as the placenta, we're going to return the birthing carriage to its original position by turning it off and then turning it back on again, and it'll just take a few minutes to back up, and then you're ready to go for another birth. Now we've placed the elevating pillow in Noelle's tummy. I've positioned the fetus in this fashion, and we'll be able to elevate the pillow, moving the fetus anteriorly so that you'll be able to palpate in the normal fashion to do your Leopold maneuvers. Now we've snapped the tummy cover onto the Noelle 552, and we can elevate the fetus using the squeeze ball. Perhaps 40 or 50 compressions will move the fetus anteriorly, and at this point you'll be able to determine whether the baby's head is down or up. You'll be able to determine the lie, and whether you have a occipital anterior or occipital posterior type of presentation. Now let's summarize the Noelle 552. The birthing torso with the fetus starting in the ROA position, the placentas and umbilical cord are all interchangeable. The cervix dilates as the baby's head moves down the birthing canal and is easily replaced. The vulva is also easily replaced. The power for the device is here. You can set the fetal heart rate from as low as 60 to as high as 200, and the fetal rate from, say, a minute, 1 minute delivery, to as long as 15 or 20 minute delivery. You can pause and resume at any point in time. Remember also that there's a speaker located right here, and you'll be able to easily hear the fetal heartbeat with a stethoscope placed at this point. And remember also that we have the ability to be able to do Leopold maneuvers with this elevating pillow that can be put into place when the carriage is back. I'm sure you'll find this Noelle system a very complete, comprehensive system. It's 5 that we've developed here at GOMART that extend from this birthing torso all the way up through something that's computer interactive, where the baby, the neonate, even changes color with oxygenation. Thanks. We hope you've enjoyed the show.